Sleep is really important for children for their developing brain. It's no coincidence that the time in our life where we need most sleep is the time when we get most of our brain growth and most of our development. We have surges of hormones that occur in our sleep. We get cortisol and growth hormone surges that then allow our muscles, our skeleton and the rest of the body to grow. So it's needed both for development and for growth. Children between the ages of 2 and 4 can learn up to 50 words a day. Those words need to be imprinted into the pathways of the brain, and that all happens during sleep. We require the most sleep when we're having the most growth. So infants and little tiny babies require somewhere between 15 and 17 hours of sleep per day. Around the age of 2, in those toddler years, it's somewhere between 11 and 14 hours. And older children, we need at least 8 to 9 hours sleep a day. We all know about nightmares. They interfere with sleep for adults and children. They're often remembered in the morning and they can occur at any time during the night. Night terrors, however, often occur early in the evening and they happen in that non-REM period of sleep. They're very predictable, they have a rapid onset. You will be unable to wake your child up and they won't have a memory of this the following morning. During a night terror, the child will look very scared, look very frightened. They sound terrified, they've got dilated pupils, and they're often hitting you and they don't recognise you as a parent. So night terrors are not remembered, nightmares are remembered, and that's one way of telling the difference between the two. If you think your child is having night terrors, you won't be able to wake them, and we suggest that in fact you don't wake them because that will make the children more scared. Just settle them down and place them back in their bed and they will fall asleep as soon as the terror is finished. What you can do, however, to try and prevent these is to do something called scheduled wakening. So if the night terrors are very predictable, they happen at the same time every night, you can go into your child, wake them, and when they're drowsy, and then put them back to sleep. And doing that for 3 or 4 nights often can turn the night terrors off. Medications have no role in night terrors and won't stop them. And if they're occurring at an older age, it's worth seeing your GP or a specialist just to ensure that it's actually not something else that's causing the sleep disturbance. The environment in which you put your child to bed and sleep is also really important. The room that they're sleeping in needs to be quiet, cool, dark, and there needs to be no devices. We know that iPhones, iPads, TVs, the blue screens from these will activate the brain and prevent children from falling asleep. The routine prior to going to sleep is also really important. They need to have a wind down period, so they need to brush their teeth, have a little drink, read a book or listen to a song, and then put to bed in a drowsy state. But routine is really important, and the earlier you can get your child into a routine where they fall asleep by themselves in their own bed, the less likely you'll get awakening periods throughout the night.